All right, so now let's talk about how to develop a search pattern on an EKG. A search pattern meaning how you can, in general, do a step-by-step process of searching for any abnormalities that can be seen on an EKG paper, okay? So if you want to develop a step-by-step pattern, you want to look for general stuff. In general, most people, when they order an EKG machine, when the paper is printed, it's printed in the form of a rhythm strip, ممتاز? And this rhythm strip right here is going to be within a 10-second interval, meaning that whenever you read a paper, you'll see all of the LEDs. You will see the LEDs that we see here. Let me just make sure. Yeah. So you have all of the LEDs here that is organized in a proper manner. LED 1, LED 2, LED 3. You have a case of AVR, AVL, AVF, V1, V2, V3, V4, V5, as well as V6. All right? They're organized in a tightly manner. And if you notice, not all of them finish all the way. For example, in LED 1, you will see it briefly. You'll see it for like 2 sinus beats, which means this one and this one. You'll see 2 sinus beats, and then it stops. And then it will show you AVR. Now, the reason why is because not all of the LEDs, you'll see them from the left all the way towards the right side of the paper. More commonly, you might just find one LED, like LED, for example, LED 2. For example, in LED 2, you might see the same LED. You might see LED 2 in this angle, and you might see it at this angle. And LED 2 will show you the entire rhythm strip from the right side all the way towards the left in a 10-second strip. Yeah, and it will show you LED 2 for 10 seconds. In this paper, it won't show it, but you might find it, all right? And you will find it especially if you have an EKG paper that's printed from a machine at 25 millimeter per second. At 25 millimeter per second, yani it will produce you this reading, this tracing at 25 millimeter per each second. ممتاز? And you can find out whether this EKG, and that's the standard, most EKG will produce at 25 millimeter per second. You'll find it whenever you see it, so I can show it to you. You can find it at the very bottom, where you can see this 25 millimeter per second. And this suggests that we are seeing, if we're going to see a LED that's at the very bottom, we're going to see commonly LED 2, we will show you the entire reading from the right side towards the left side at a 10-second duration. That's important when it comes to calculating the heart rate. But otherwise, a lot of the other LEDs, when they show the rhythm tracing, starting from this drawing right here, they will show it within 2.5 second duration. So you'll see LED 2 for around 2.5 seconds. This one for 2.5 seconds. This one for 1 second, for example. Okay? Now, if you're going to notice an EKG paper, you'll notice that the EKG, it is composed of squares. So you can see a lot of squares here, and these squares, each one is a big square. Each big square is composed of 5 small squares that we're going to see in the board. ممتاز? So what are these squares? What do they signify? How can we assure that when we have a normal sinus beat, meaning P, Q, or ST, when we have a normal sinus beat, how can we tell if it's normal or not, really? Just besides looking. All right, so let's talk about that now. But for now, we started at the beginning of the video talking about how the machine it produces a rhythm strip. It produces for you typically a 12 LED EKG. You'll see all the 12 LEDs here. It will be produced at 25 millimeter per second, which means you'll see LED 2, you'll see LED 2 here, and another LED 2 here, showing you the whole rhythm strip. You can look at it in Google. And it will be within 10-second duration. ممتاز? So now let's talk about the squares in the EKG. Why we should know about the squares? So we can know how to calculate the heart rate and other remaining steps. So of course, the first step in searching on an EKG paper is the heart rate. ممتاز? Then followed by searching for the P wave, the QRS and the QT, and assessing the normal duration of each one. And then you look at the axis, the shape of them, of the P wave, the QRS, as well as the T wave as well. We'll come to each of them step by step. But before we go through each step, each way of searching the EKG, we need to understand the components of an EKG paper. Besides the rhythm tracing, we should understand the squares. All right? Now, as we remember from previous video, we talked about the LEDs, 12 of them, how each one really looks at the heart from a different view, inferiorly, laterally, right. And we talked about the cardiac axis, in which we have a vector going inferior-laterally towards the left, depolarization, and we have a leg that's placed at different angles of orientation. Now let's talk about the squares. Now, here we have one square here. We have one big square. And this one big square is composed of 5 small squares. So 5 small squares vertically as well as horizontally. ممتاز? 5 small squares. Now you see, there are 2 factors here, or 2 parameters, that is going to be read at this square. ممتاز? 2 parameters. You have an amplitude and you have a duration. Amplitude going vertically means we will read the square vertically, and we will read the duration, which means we will read the square horizontally. So amplitude, what does it mean? Amplitude, it means the power. It means how much electricity, how much is being depolarized at a specific area. For example, if we revise our sinus beat from before previous video, we have the P wave, followed by the P wave, starting from the beginning, we have the P wave, then we have the PR interval, then you have the Q, R, S, ST segment, followed by a T wave. And then we'll have another sinus beat following that, another cardiac cycle. Now, why is the R wave, why is it bigger than the P wave? As we mentioned before, the R wave represents ventricular depolarization. And the ventricle is so much bigger. So that means there's a lot of depolarization and there's a lot of contraction going on as compared to atrial depolarization. So more power. So it's natural that the amplitude of the R wave will be greater than the amplitude of the P wave. ممتاز? So it measures the power. You read it vertically. And what is the unit? What is the unit? Well, if you read from each small square vertically is equal to 1 millimeter. Or 1 millimeter, يعني 0.1 millivolt. That's for each small square. Now, if you do 1 times 5, يعني if you read each of them all together, 1, 2, 3, 4, 5, 5 small squares is equal to 5 millimeter. ممتاز? So when we're reading a big square from a perspective of an amplitude is equal to 5 millimeter. ممتاز? 5 millimeter, a big square. However, when we're measuring a small square individually, it's equal to 1 millimeter. So 1 millimeter, small square. 5 millimeter, big square for the amplitude. ممتاز? And that will be important when we come to it in upcoming videos. Now, this is for amplitude. What about duration? The same concept, but horizontally. Each small square is equal to a very specific unit, known as 0.04 seconds. ممتاز? So each small square is equal to 0.04 seconds. 0.04 times 5, so 0.04, 0.08, 0.12, 16, 0.20, 0.04 times 5 is equal to 0.20. So, one small square is equal to 0.04, one big square is equal to 0.20 seconds. ممتاز? This is for the duration, and this duration is also very important for upcoming videos. ممتاز? Especially when we want to know the PR interval. Is this PR interval, is it shortened or is it longer? Is it prolonged? The QT interval, is it prolonged or shortened? The QRS complex, is it wide? Is it narrow? How do we know? By assessing the duration. We have a specific range of numbers for each one. How do we know whether this T wave is it normal or not? We will know it's normal when it is smaller in amplitude as compared to the R wave. Because if you have a T wave it is as big as the R wave, this is known as a hyperacute T wave. This is an abnormality. So that's why knowing the parameters is important. And this is what this square is composed of. Vertically, we're talking about the amplitude in millimeter. And horizontally, we're talking about duration with 0.04 seconds or 0.20 seconds in a big square. ممتاز? So we will see these squares surrounding it in the background. We will see these squares in the background. ممتاز? ممتاز. So now that we've got that out of the way, now let's talk about practically about how to calculate the heart rate. And one more thing I just want to mention before we go to the heart rate, there's just one more thing that we need to keep in mind when we're reading a normal sinus beat. ممتاز? You see the QRS complex, this is the QRS complex, right? Let me put it here. P wave, we have a P wave, we have a PR interval, Q, R, S, T wave, and there's an ST segment, and there's also a QT interval here. ممتاز? And I'll put it in the black line, just as a little reminder. This is PR interval, this is QT interval, this is the ST segment. ممتاز? Now, before we go further with the heart rate, I just want to mention, regarding QRS complex, the first negative deflection after P wave, if you see a negative deflection that comes after P wave, this will always be known as your Q wave. ممتاز? This is your Q wave. However, if you see an upward deflection, the first upward deflection you see after a P wave, this is known as your R wave. So, any negative deflection that comes first, followed by a P after a P wave, Q wave. However, if you have a positive deflection, the first positive deflection that comes after a P wave, then is known as the R wave. Now, if for example, I have an R wave, let's say I have let's draw it here. Let's say I have a P wave, I have this positive deflection, and then I have a negative deflection, and then followed by a T wave. ممتاز? This positive deflection, the first one I see after a P wave, R, like usual, right? Question, will this negative deflection that comes after the P wave, this negative deflection that comes second, that comes after the R wave, this one right here, will I call it a Q wave? No. This will be known as an S wave. There will be no Q wave because a Q wave, it will be considered when we have this negative deflection coming here. The first negative deflection after P wave. But if we don't see it, we see an upward deflection, then a negative deflection after this R wave. This will always be known as an S wave. ممتاز? Another scenario. What if following R wave, ممتاز, following R wave, we have an upward deflection. ممتاز? We have an upward deflection. And then a negative deflection. Let's say, following R wave, we have another upward deflection. Another one, a twin. What do we call this? We call this R prime. ممتاز? And this is the S wave. This is R prime, which is the brother of the R wave. And this also is very important to know when we come to upcoming videos about right bundle branch block, giving a rabbit ear appearance. But I just want you to know, I need you to know, the QRS complex has different configurations. Configuration meaning different forms. Some of them may show an RRS configuration. Some of them may show an RS configuration. Some of them may just show a Q configuration. So that's also a very final thing, a final concept we want to know before we proceed further. ممتاز? Now we complete this complete reading, ممتاز, of the sinus tracing. Now, let's proceed further. How to calculate the heart rate? Very simply, when we talk about the heart rate, we need to ask ourselves a question. How am I calculating the heart rate, which is from 60 to 100, above 100 techie, below 60 brady? If I'm calculating the heart rate, do I mean the atrial heart rate or the ventricular heart rate? Usually when people say the heart rate, you mean the ventricles, right? You mean the ventricular heart rate. They don't mean the atrial heart rate, which how you calculate it is a little bit different. ممتاز? The same concept, but a little bit different. So the first question you should ask yourself, if I want to calculate the heart rate, am I calculating the atrial heart rate or the ventricular rate? ممتاز? Let's say we're calculating the atrial heart rate. What is atrial heart rate? يعني from one P wave to the P wave of the next one. ممتاز? This one and this one. Sorry. This one and this one. Thus, I will look at the PP interval. The PP interval meaning the distance. Remember, interval means distance. So I'm going to look at the distance between this P wave and this P wave, ممتاز? And I will measure the number of squares between them. Or if I want to calculate the ventricular heart rate, I will use the RR interval. I will look at this R wave, I will look at this R wave, and I will measure the distance between them. So, in order to do that, I need an R wave that is perpendicular to a line. So basically, when I'm reading an EKG, I should find an R wave here. I should find, for example, an R wave that is intersecting a line. So for example, let's say we have this line. Let's say we have this R wave. Let's say it's within this line right here. ممتاز? If I can see it within this line, intersecting with it, then I can calculate the then I can calculate the RR interval. If I see a line of an R wave intersecting this line, I can go forward and calculate the RR interval, which is the distance between this one and this one. ممتاز? How do I measure the distance? By counting the number of big squares or the number of small squares between them. So, let's go back. This is how you calculate it. ممتاز? First, I need to ask myself what the heart rate. Atrial or ventricle? If atrial, the PP interval between this one and this one. ممتاز? If ventricular, RR interval. ممتاز? Then, if I find the interval, next I need to ask myself, is it a regular rhythm or an irregular rhythm? What does that mean? That means very simply, ممتاز? That means very simply. When we say that the rhythm is regular, we practically mean, for example here, look at leg 3, what we practically mean is that the distance between this R wave and this R wave, the distance between them should also be equal to this one. So there should be an equal distance in this one, equal distance in this one, equal distance in this one. This is a regular rhythm, ممتاز? An irregular rhythm would show a distance that will be here short, well the next one will be long. So this one could be short, this one could be long. This one could be short, short, long, irregular, right? So that is what it looks like. So we need to ask ourselves whether it's regular or irregular rhythm. Is this regular between the RR interval or between the PP interval or not? Because if it's regular or irregular, this is important to know because this will affect how you will calculate the heart rate. If it's irregular, we have to use a different method as compared to a regular rhythm. Now, since most EKG papers are being produced at 25 millimeters per second, that means within a 10-second duration, that means that most cases, in a normal case, in a normal reading, it should be regular. ممتاز? So if you find the reading, if it's at a regular rhythm at 25 millimeters per second, then you have two methods of calculation. You see, between one R wave of one sinus beat and another R wave, RR interval, there will be a square between them, right? There will be a square between them. So what do? I will count the number of squares. I will choose. Do I count the number of big squares or do I count the number of small squares? Whichever one is according to your case. Which one is easier or more accurate according to the case? So if I'm going to calculate by the number of big squares, well, I will do 300 divided by the number of big squares that I see. See, if I see here, for example, 1, 2, 3 big squares between the RR interval or within the RR interval. If I see 3 big squares, I do 300 divided by 3. 300 divided by 3 is all but likely going to give you 100. ممتاز? It's going to give you the normal ventricular rate. Or 2 big squares, 150. 1 big square, 300. 4 big squares, 75. 5 big squares, 60. 6 big squares, 50 beats per minute. ممتاز? By counting the number of big squares, so I do 300 divided by the number of big squares. Why 300? Because 300 is practically, 300 is basically equal to 1 minute. It's a long, complicated case as to why they chose 300. It's basically equal to 1 minute. So what matters is that you do 300 divided by the number of big squares, and it will give you the number of beats per 1 minute. So that's why I chose 300. 1,500 That is if you want to count the number of small squares. Mumtaz. The same concept, but the number of small squares. So 1500 divided by the number of small squares, it will give you how many beats per minute. Mumtaz. So big squares, and it will give you how many squares. So these numbers 1, 2, 3, 4, 5, 6. There's a number of big squares, and give you the heart rate in بشكل عام. And then the small squares, again 1500 divided by the number of small squares. These two calculations, you can choose either one, whichever one is easier. This is, you do it if there's a regular rhythm, which means you can see an R wave intersecting a line, and thus you can see the RR interval between them, the distance between this R wave and this R wave, and count the number of squares between them. This is if it's regular. But if it's irregular, we need to use the 10-second rule. The 10-second rule means I will count the number of R waves in 10 seconds. This is especially can confirm if you have a reading that says 25 millimeter per second reading. So if I find this paper right here, it shows me that the paper speed is 25 millimeter per second. Let's say we have lead 2 here, and it's showing me this reading, and it's spread out. It's showing me this reading from the right all the way towards the left within a 10-second period. Mumtaz. What do? I count the number of R waves. I count this one and this one and this one till I reach the end. If I reach the end, I count the number of R waves. Let's say I have a total of 14 R waves within a 10-second period. What do? I time it by 6. Once I time it by 6, it will give me the heart rate at an irregular rhythm. So if you have an irregular rhythm, use the 10-second rule. In my paper, it's not found here. You'll not see a lead going all the way. But in a 12-lead EKG, you will find it. So this is following the 10-second rule as long as the paper speed shows 25 millimeter per second. Because this means we have a reading of 10 seconds. So you can continue counting. 1, 2, 3, 4. The number of R waves in 10 seconds, time it by 6. Mumtaz? That's pretty much it for the heart rate. Mumtaz? Anything I mentioned is the same concept for the atrial rate using the PP interval. Mumtaz? Now, we finished with the heart rate. Next, we need to know the normal duration. We need to know the normal duration of the PR interval. Mumtaz. We need to know the normal duration of the PR interval, as well as the QRS, as well as the QT interval. We need to know the normal duration, prolonged or shortened. Mumtaz. So here's the PR interval, right? Which is from the beginning of atrial depolarization to the end, or to the beginning, of ventricular depolarization, from beginning of this to this. The PR interval represents conduction delay. And we should know about it because it can be prolonged, especially if you have a block. If you have an AV block, it can be prolonged. First degree, for example. And it can be also shortened, like in Wolff-Parkinson-White syndrome. So we should know the normal duration. The PR interval normal duration, the normal duration is between 0.12 seconds to 0.20 seconds. Mumtaz? That's the normal range. What about the QRS? The QRS should be narrow. When you look at it, it should be narrow. Like in this drawing, or in this drawing as well. It should be narrow. So, the range, the normal duration, is 0.8 seconds or less. So an equivalent of 2 small squares. You should only see 2 small squares within the QRS complex. Because if it's widened, you can see it in wide complex tachycardia. Mumtaz? So that's one thing. So we have the QRS complex. It should be 0.8 seconds or less. Now, if it's more than that, it's widened. That's abnormal. Mumtaz? Now, we have the final thing, which is the QT interval. The QT interval, Mumtaz, of course, just to remind you, the QRS is this part, Mumtaz. The QT is this part. The QT interval, there's a range for it, but an easier way, a simple way of knowing whether the QT interval, whether it's prolonged or not, is by seeing. You want to see, is this QT interval, is it occupying 50% or more of the RR interval or not? What do I mean by that? I mean, if you see this T wave, Mumtaz, let's say this T wave. If we see this T wave, let us place it over here, Mumtaz. let's say this T wave is placed over here. Mumtaz? Now, when I look at the QT interval, it is prolonged. It is prolonged. And now, this QT interval occupies up to 50% or more of the RR interval, which is abnormal and actually very dangerous because there are many medications that can prolong the QT interval. Fluoroquinolones, for example, a lot of anti-epileptic agents, tricyclic antidepressants, they can prolong the QT interval, and that's very dangerous because they can predispose to a very dangerous arrhythmia known as ventricular fibrillation. And we'll go to that, inshallah, in the upcoming videos. So, the QT interval, it should be less than 50%, or in some books, less than 40% of the RR interval. The T wave, specifically, should be less than half of the RR interval occupying it. Mumtaz? So that's the QT interval. Now we finish with the interval. So that's the second thing, by the way, you should check. You should check the heart rate, check the QT interval, the QRS and the PR. You should check the ST segment. You can just check it if it's flat or it's elevated or depressed. But you can leave that for later, the ST segment, yani. Then the next step and the final step for today's video is to check the axis of each one. What do I mean by each one? I should check the axis of the P wave, I should check the axis of the QRS, and the axis of the T wave. What do I mean by axis? I mean deflection. I mean the P wave should be positive deflection. The T wave should be positive deflection, according to the lead. QRS should be positively deflected, regardless. Mumtaz? So that is meant by the axis. So, axis, very simply, there's a very simple rule. And we'll come to the cardiac axis. To know whether the axis of the P wave and the QRS and the T wave, whether they're normal or not, revise one more time about the cardiac axis. So remind you about the cardiac axis, which are all these legs that are placed together, recording this vector going inferiorlaterally towards the left, right? You see, in order to know whether these axes are normal, I will look at two specific leads, two specific leads. I will look at lead 1 and I will look at lead AVF. Lead 1 is recording the heart at 0 degrees. Lead AVF is also recording the heart inferiorly at plus 90 degrees. You see, we have a range here. This range between 0 to plus 90 degrees, or in some books, to be more accurate, from minus 30 degrees in AVL, from minus 30 up to plus 90 degrees, this ratio, this is your normal axis deviation. This is your normal direction of the vector. You see, when we talk about the QRS and the P wave and the T wave, their duration, their range should be positively deflected according to the lead. They should all have a positive deflection. That means that they should be the QRS axis, the P wave axis, and the T wave axis. These axis deviation, these axis deflection, it should be between minus 30 to plus 90 degrees. What does that mean? That means that this vector, since it's going inferiorlaterally towards the left, that means since it's going this direction, this means lead 1 will record P wave upward deflection. This means lead 1 will record QRS and T wave upward deflection. Same goes for AVF. Since the vector is going inferiorlaterally, AVF will record QRS upward deflection, P wave upward deflection, and T wave upward deflection. Right? Upward deflection. As long as the vector, this is as long as the vector is going inferiorlaterally between minus 30 to plus 90 degrees. Because if we have a right axis, if we have a right ventricular hypertrophy, then this vector will not come to the bigger right ventricle. There will be a right axis deviation. You'll have a right axis deviation. Or if you have a left ventricular hypertrophy, then now some of these vectors, they can go upwards. they can start to go upwards towards the left. And now this vector will go towards the left, and thus it will give us different findings on an EKG. So let me show you in this paper right here. So to summarize, the axis of the QRS and P wave and T wave, they should be positively deflected. In most cases, with the exception of AVR, it will always be reversed. But in most cases, it will be upward deflection. So we will choose two LEDs, LED 1 and AVF. Both of them should have a positive deflection for P wave, QRS, and T wave. Mumtaz? This means if we have a positive deflection in LED 1 and we have a positive deflection in AVF, this is normal. This means this vector is going inferolaterally. It's between -30 to +90 degrees. It's not deviated towards the right, it's not deviated towards the left, nor is it deviated towards the extreme right. Mumtaz is towards this range right here. So, to assess for axis deviation, you will very simply look at the QRS complex of LED 1 and AVF. You will look at these two, and you will see that there's an upward deflection of a QRS, for example, and an upward deflection of the QRS on AVF. If there's upward deflection on both, this is normal. You have a normal axis deviation. Same goes for T wave, same goes for the P wave, the same concept. However, if we have an upward deflection in LED 1 and we have a negative deflection in AVF, this is abnormal. This is left axis deviation. That means that the vector over there, this vector went towards the left. That means it went between 0 to -90 degrees, from 0 to -90 degrees. This is left axis deviation. This means that LED 1, the vector will come towards it, so it will still have a positive deflection. But AVF, the vector will not come towards it inferolaterally, so that means it will show a negative deflection, left axis deviation. They are leaving each other. Mumtaz? However, if we have a right axis deviation, that means LED 1 has a negative deflection, AVF has a positive deflection. What that means is now the vector has been shifted towards the right, between +90 to +180 degrees. AVF still has a vector coming towards it, so positive deflection. But LED 1 will not have this vector coming towards it, so it will have a negative deflection. This vector is going away from it, negative deflection. So we show a right axis deviation. And always make sure to confirm whether there's an axis deviation right or left, always make sure to check for LED 2. Mumtaz? This is obviously LED 1. Well, I was just imagining this is LED 2. This is LED 2, we're imagining it's LED 1. But if we're always checking for LED 2, Mumtaz, we should always check for LED 2. So basically, if I confirm right or axis deviation from LED 1 and AVF, I should also check for LED 2. I should check for LED 2 as well. Sorry for the confusion. I should also check for LED 2. Basically, if I have an upward deflection here and an upward deflection here, this is normal. But if I see any abnormality, if one of these two are negatively deflected, I should also look at LED 2 if it's also positively deflected or negatively deflected. Because in some cases, you might have LED 1, it might show positive deflected LED 1, and AVF may show a negative deflection. You might say this is left axis deviation. However, if LED 2 shows a positive deflection, then we will consider this as normal, even if there's a negative deflection in AVF. So, LED 2 is your confirmatory test when you're assessing for axis. You should check for LED 2 after you look at 1 and AVF. If it's also negatively deflected, halas, this is confirmatory left axis deviation. Mumtaz? And that's why in some books they say that the normal axis deviation, the normal, is not between 0 to +90, it's between -30 to +90 degrees. They expand it a little bit further. Mumtaz? They include LED 2. So that's pretty much it for the axis deviation. For QRS, for P wave and the T wave, the same concept. Mumtaz? You look at LED 1. If you want to think of it a little bit easier, this is LED 1, this is AVF. This is normal axis deviation. This is left axis deviation, where they're leaving one another, LED 1, AVF. This is right axis deviation. They're right for one another. Mumtaz, they're very much right for one another. If both of them are negatively deflected, they're extremely right for one another. That means there is an extreme right axis deviation if there's a negative deflection in both of them. ممتاز? And this is a very important concept to know because it's a non-specific sign of abnormalities we'll see inshallah in future videos, like bundle branch blocks, like hypertrophy, and so forth. ممتاز? We'll come to it later on. But for now, we finish with the axis. And thus, we finish with the first 3 steps of searching on an EKG. I recommend you look on Google and you revise the heart rate, calculating the heart rate, assessing the PR, the QRS, and the QT interval. And then you look at the axis of the P, the QRS, as well as the T wave as well. ممتاز? We finish the first 3 steps in each of them in all the details. ممتاز? In the next video, we'll talk about abnormalities at last.